Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752 and check out Dr. Darrow's website at www.lastemcells.com. And remember, when you call the program, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Dr. Darrow, would you like to speak to Carol in Los Alamitos?
Of course. I'm going to give out the phone number to the studio first, and then my office. The studio number, so you can talk to us live, is 866-870-5752. And if you want to reach us at the office, if you miss the show and you want to just call later, it's 800-300-9300. And the website, if you want to watch me doing videos of these procedures, is www.lastemcells.com. And you can email me from there also. Every page has an email spot. And we're going to go to Carol. Carol, hi. How are you? It's Dr. Marc Darrow.
Oh, thank you. Yeah, I'm calling about my boyfriend. He's 61 and has had just a shoulder that's bone on bone.
Okay.
And he kind of thinks that surgery is the only option. And just curious, do you do many shoulders? Have you had any success with bone on bone?
I do shoulders every single day, and I have a lot of success with that. And bone on bone is a statement that's false in most cases. So most of my patients come in and they say, I've got bone on bone. And then I move around their shoulder, their knee, their hip. That's supposed to be bone on bone. And it glides and moves. And I laugh and I go, your doctor didn't really tell you the truth. It's not bone on bone. And so it's a term I don't like being used. And the way I describe it is this. Have you ever, Carol, had two bricks put together and tried to slide them?
I mean, hypothetically.
Hypothetically, good. Okay, well, I've tried to do it. It doesn't move. And that's what bone on bone would feel like. If the arm moves, it's not bone on bone. There's cartilage there. Do you understand that?
I mean, yeah, sure. So what kind of success have you had with bone on bone?
I know, but you just...
Okay, so what's perceived as that? I'm sorry.
Yeah, a lot of success. Every day I have success with it.
Even if it's indented, like if it's rubbed a dent.
Well, it depends. It depends. That could be what's called a Hill-Sachs deformity, and I treat a lot of those too. It just depends. I've got to examine a person to let them know if this is appropriate treatment for them using stem cells or platelets. It's not something I can diagnose over the radio. I wish I could. I don't have X-ray vision across town, and an examination is needed.
Would it be helpful, like, for someone to bring you X-rays, like if they came for an appointment?
It's helpful, really, mainly to rule out things like cancer and tumors and stuff, which is rare, but I've seen it. My examination tells me everything. I do like, occasionally, if there's an issue that doesn't heal right away, then I like to get an image, MRI, X-ray, depending what part of the body. But it's not mandatory. Is your boyfriend sitting there with you?
No.
Okay. Otherwise, I'd talk to him and get a little more information. Can he lift his arm up at all?
I think he can lift it like up shoulder height.
Okay. So there's a couple things going on there. He may have some arthritis in there, and he may have some.
Golfer.
Yeah, golfing can do that. Let me tell you. I treat so many golfers; it's crazy, and I'm a rampant golfer myself. But anything repetitive can do it. But the other thing that could be going on is he could have, besides some arthritis, he could have what we call adhesive capsulitis or frozen shoulder, which has nothing to do with arthritis. He could have a little bit of both of them. Or he may just have adhesive capsulitis and no arthritis. That's why I've got to do an examination and check him out.
Okay. That's how, and what's the current, if someone calls, say, this coming week, typically how long do people wait to get in?
Well, if you tell them you called in on the radio show, tell them I said you can get in anytime you want.
Oh, my.
I'll always slip somebody in if they call the radio.
Okay. All right,
Yeah.
so worth a try. And you've had success with, I mean, is this like an ongoing treatment or is this?
That's a good question. It depends on what the person does with themselves. So, as an example, if I get a high-level athlete and they've got, as an example, there's someone, I won't give you his name, although he probably wouldn't mind it. He came in because he had severe arthritis in both his knees, and he's a very high-level skier and bicyclist. He does 200-mile bicycle races in the mountains, and he's a top-level skier. He's retired. He's a wealthy man, and he comes in all the time. He doesn't need to because we fixed him after like 3 treatments, and he was pain-free. But he still comes back maybe like 2 or 3 times a year because he wants to be proactive. And after the pain in his knees went away, he showed up again. I said, "You don't need to come back." And he says, "No, I need to because I know that I created all this arthritis by doing all of the sports, and I know it's going to come back at the same level of sports that I do." So he shows up once in a while. Does he have to? Probably not. So it's one of those things, part of it's subjective. That means the person decides for themselves what they're going to do. I can't tell someone what they should do. And I can't tell if a person has pain. I see x-rays and MRIs that look terrible arthritis, and the person has basically no pain. And then vice versa. People can have tons of pain, and then their imaging study looks perfect. So a lot of pain is subjective.
True. Okay. Well, it sounds like it'd be worth a try since the shoulder surgeries are so kind of precarious and not always successful.
Well, I don't know if you were listening to the beginning of the show. I told the story when I was a 4th-year medical student doing orthopedic surgery, and I tweaked my shoulder weightlifting, and I had my boss, my professor, operate on it. And a very simple surgery. It was called a shoulder decompression. They just cut some ligaments and shaved off part of the acromion. And that thing blew up. It turned out terrible. And I didn't blame the surgeon because that's just part of surgery. I liked him. But the surgery was a catastrophe for me for about 4 years until I learned about doing regenerative medicine. I injected my own shoulder, and it healed literally overnight. It was a miracle to me. And that led me to doing this as my work. This is the work I do, and I rarely ever use a steroid shot, and I do this naturally with the healing. I'm a natural healer, if you want to call it that.
Okay, and you had some success in lumbar, like stenosis and spondylosis.
Yeah. All those, see, when you have a diagnosis, that doesn't mean that tells you where the pain is being generated from.
Okay.
So you can have stenosis and have no pain, or you
yeah.
can have stenosis and have terrible pain. And
but if you have narrowing of foramina and pressure on nerves, is there much that stem cells help with that?
Well, see, I'm going to repeat this again for you. There are people that have that condition on an MRI and have no pain down their legs or in their back or neck or arms. So they don't even know they have it. It's found serendipitously. And then there's people that have pain down their legs, as an example, and you think it's a sciatica, and then you do an MRI and nothing shows up with foraminal stenosis like you were just mentioning. And then the doctor scratches his chin and doesn't know what's up. You can have facet arthropathy, where the facets are a little overgrown with minimal arthritis, and that can radiate all the way down the leg, and there's no surgery that can fix it. So it's not something I can describe on the radio for someone to tell them what's going on. I need to do an examination, move the body around, touch the area, and I get people in every single day who are ready for a surgery, and we heal them without a surgery by just injecting these cells, these platelets, PRP or stem cells, because surgery was not the right thing to do in the beginning. It's just that doctors, unfortunately, are not educated to this yet. Even though it's been around 120 years, doctors are not into it because it's not part of the medical industrial complex of making money.
Okay. Well, then, thank you so much. That's helpful.
Anyway, bring your boyfriend in. I'll examine him, and I'll let you know what I think. And the phone number to the office, if you want to call up and make an appointment, is 800-300-9300. If anyone else who's listening wants to talk to me live right now, I would love your questions. And the phone number to the studio to talk to Nita and I is 866-870-5752. Actually, talk to Nita and me, not I. Right, Nita?
Thanks, Dr. Darrow.
Good job.
Thank you so much.
Thank you for your call, Carol. Okay, so we have a moment of no calls. Do you have an email you want to talk about?
Oh my
I know
gosh,
you.
do
Did you
I
say what else is going on in the office yet today?
Yes, I'm going to tell you. We're doing vampire facelifts, which is injecting these cells into the face to regrow the collagen, make you look young, and also on the top of the head for those of you with thinning hair. And it works pretty good. If you're completely bald, don't come in. But if you've got some hair there and you just want to thicken it up, it can work for that.
I wonder why it doesn't work if you're completely bald.
Well, it could. It's just that it would take a lot of treatments. And I don't think people want to go through with that.
Okay. Well,
I'm going to go to a question here, if you don't mind.
Well, I just was going to tell people how they could get your book.
Okay, get the book free book. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And it's a $25 value. It's, 200 pages, 250 studies. That's right, scientific studies showing how regenerative medicine of PRP, platelet-rich plasma, and stem cells works, and how surgeries fail. I'm not putting down the surgeons. I love the surgeons. I just don't like the surgeries that they do most of the time. If it's an emergency, go get a surgery. If it's elective and you get to decide, please consider doing regenerative medicine first and see if that works.
Okay.
Let me go to we have someone calling in.
We do.
Let's see. Maybe I'll do a quickie question. Oh, here it is.
Wait, Jay is here.
I know. Jay, you are here. You have a question about treatment for arthritis. Hola, ¿qué tal?
Muy bien.
Oh my God. I would love to learn Spanish, but I've got to go live somewhere else to do that, I guess.
It only took me to about 15 years to master it, sort of.
Sort of, exactly. So, Jay, you've got a question about arthritis. What kind of arthritis are you talking about?
Well, my sister-in-law was going in to get shots of, I guess, cortisone shots or whatever for her knee. Apparently, she's experiencing a lot of pain in her knee, and so she was going to go in and get cortisone shots or whatever they do with that.
Sure.
I recommended she check into you.
Thank you.
And the problem is she's a college educated, got a salad bowl of letters behind her, RN, la 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 la,
sure.
a PhD, And so she texts me back, says, it's not an approved procedure.
Sure. Well, that's a shame because what is approved, I'm not sure of. People say the FDA doesn't approve of this, but the FDA is not supposed to approve of it. That's Food and Drug Administration.
Of course, the reason I mention this is I am a big believer in natural healing, but I was wondering if you use this to treat osteoarthritis.
Yes, I do every day of the week, all day long.
And whether or not you've got any documented success with it.
Yes, I have plenty of studies that we've done.
I'd like to point her in that direction.
Yeah. She can go to the website, www.lastemcells.com, and there's some studies there we've done in the office. We're going to send you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. That's got tons and tons of studies on this. And
my brother's also a doctor. He's a nephrologist.
Okay.
And another triple PhD, and so
sure.
Between the two of them, I don't think that they consider anything outside the university of what is possible in treatments for patients. I don't know.
I'm going to tell you the opposite, because I stay away from people like that, from doctors like that. And, to be honest, I think they hurt a lot of people. What I do isn't hurting anybody. If it doesn't work for you, go do other things. And if it doesn't work, there's reasons for that usually. It's either you get a doctor who doesn't know what they're doing, a doctor that doesn't use ultrasound to guide the needle, a doctor that just hasn't had the experience, or a patient that has too much activity.
Yeah.
There's a lot of reasons.
I think the problem with all of these university medical centers is that they get caught up in a bubble, and they really don't get outside the bubble of what it is they think they're learning. And I argue. Go by the by.
I argue with all my doctors and all my doctor friends, and I tell them what I think of them, and they tell me what they think of me, and it doesn't resolve. It's like the Middle East, It goes on and on and on. And
like the Middle East,
yeah, it goes on and on and on. But I've got studies on what I do. I do studies in the office, and that's honestly.
Is there some reason that the insurance companies aren't willing to pay for stuff like this when it costs so much less?
Sure, the insurance companies are stuck in the medical industrial complex, and it's a big system. It's not going to change anytime soon, and especially at this point in history, economically, insurance companies don't want to pay more money out. They're cutting.
But now that it's become politically infested, where you've got politicians deciding what's medicine, it's really worse than ever now.
Well, you're right, and when you talk about the FDA, a lot of politicians end up in the FDA, or vice versa. FDA guys end up in the politicians' offices. So it's a very...
they're invested in the system itself.
They're invested in the system itself. You got it. You're a very smart guy, Jay. Thank you. It's been a great talk with you.
It's a pretty good deal for them. Not so good for everyone else's health.
No, it's not good for health at all. It really is not good for health.
Well, it's nice talking to you again. And
you too, and thank you so much for calling, Jay. Yeah, thank you.
Thank you, Jay.
And good health, huh?
Yeah. So I'm going to... Salud. I'm going to give out the phone number again to call me and talk to me live. That's 866-870-5752. We've got a few minutes left. And then if you want to catch me at the office or talk to someone about things we missed here, the office number is 800-300-9300. And we're going to go to Bob in just a second. But I want to read this because this is really amazing. It's very touching. I just got this text about 10 minutes ago, and it said, "Hi, Mark. Good morning, happy holidays, Merry Christmas, and a Happy New Year. God bless you. I want to say thank you for everything. Thank you very much. Merry Christmas, Happy New Year all together with your family. Thank you, man. Thanks. That's all I can say. You break my heart. You are so very nice person." This is someone who's Spanish speaking, I guess. "Thank you. God bless you." And I get this all the time because this particular person, I think I know who it is, a Spanish gardener who works here. And he asked if he could bring his mom in, who had very, very arthritic knees, really arthritic knees. And she flew up from Mexico. I said I would treat her for free, and I did. And she is doing so well, and I'm so grateful. And I love helping people. I had a patient yesterday who had very good success and said, you know, Dr. Darrow, you don't work a minute in your life. This is your hobby. And I said, you know, I never thought about it like that, but it is my hobby, and I love it. People call it work, but it's not for me. I love what I do, and the success rate is so high, and I get to make so many people happy. And when you're happy, I'm happy. When you're not happy, I'm not happy, and that's just the way I am. That's the way I'm built. So I do the best I can, and I help a lot of people out, and I'm just very grateful to do this work. So, Bob, you have a question about knee pain. We're getting a lot of stuff on knee pain. Tell me, what's up? Bob, are you with me?
The last couple people have been talking exactly what I'm talking about. So I have osteoarthritis in my left knee, and I had arthroscopic knee surgery about a year and a half ago, and it comes and goes, the arthritic pain. And I guess I have moderate arthritis, so says the doctor I see. So tell me, the stem cells and the PRP, what exactly does it do that everything else hasn't been able to do to fix my arthritis pain?
Okay, so typically in a surgery, tissue is removed. They do cleanouts. You know, they take all the loose tissue. Right. If there's a meniscal tear, they often cut off part of the meniscus. Not always. Sometimes a surgeon will. You know, I make patients do this with doctors, where they make the doctor sign something, say they're not going to remove any tissue. They'll just sew up any damage, and those people often can do fairly well. But that's not typically what's done. And once tissue is removed, that joint has arthritis in it. Okay, it's immediate arthritis. So you go in for an arthritis problem, and you end up with more arthritis, and then you lose the integrity of that joint. Okay, it's never going to function the same way again. Your pain is on and off, so I would, if it were my knee, I wouldn't have had the surgery because I did that on my shoulder before I knew anything about this, and it came out terrible. Then I fixed it self-injecting myself. If I were you, I'd come in and get some injections to fix it. I don't know what else I can tell you. And what does it do? It regrows the tissue. So when surgeons take tissue out, my job is then to regrow it. It's crazy. Why ever take the tissue out? Doesn't make sense to me.
So I talked to my dad a long time ago, and he told me, he said, pain's an indication that something's wrong. So your procedure, would it help obviously greatly if you found out about it once you get pain, or before you get pain, you know it's coming, or does it matter? I'm 64, and I know my history with athletics and what I've done to my body.
Well, this will be sort of an answer. Dave Asprey, who has Bulletproof Coffee, does his whole body. And he says he's going to live to 150. Am I telling people to prophylactically do their whole body? No. So typically the people I see have some pain. But sometimes they'll come in, let's say you've got a high-level athlete and their right knee hurts, and they go, I think it's just a matter of time before my other knee goes. It's starting to. Should I do it? And I go, then you should do it. Yeah, do them both. God bless you all. Thank you very much, Bob. And if anyone wants to reach me at the office, the number there is 800-300-9300. The website is www.lastemcells.com. You can email me from there. Thank you, Nita Valens and Suzette, Alex, and Jose, and the whole crew. God bless you.
Thank you, Dr. Darrow. Remember to hear the Pet Show with Warren Eckstein from 11 to 1 every Saturday, and we'll see you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. right here at AM 870 The Answer. Remember, to take the first step toward a pain-free life, call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.